Hey everyone, ready for another deep dive? Today we're going to tackle lipoedema self-care.
Ooh, good topic.
Yeah, and we've got some great info from Physiopod UK Ltd,
They know their stuff.
all about deep oscillation therapy.
Interesting.
So, if you're dealing with lipodema, self-care can be a game changer.
For sure. It can be. And it's interesting because lipedema is a bit of a mystery still for some people, right? It's not just like
It's different.
extra weight.
Yeah.
It's like this abnormal buildup of fat. And it can be really painful and make it hard to move around.
Yeah, it can really restrict movement.
Exactly. So managing it takes more than just, diet and exercise.
It's more complex.
Yeah, you need a whole toolbox of approaches.
A multi-pronged approach for sure. And deep oscillation therapy is one of the tools in that toolbox.
Right.
But it's not like something you hear about every day, is it?
Not really.
Mm-hmm.
It's a non-invasive treatment.
Which is appealing to a lot of people.
Yeah, a lot of people like that. What it
Yeah.
does is it uses like electrostatic attraction and friction to create these super gentle oscillations, kind of like tiny vibrations deep within the tissues.
Deep? How deep are we talking?
Think up to 8 centimeters deep.
Wow.
That's deeper than a lot of manual therapies can reach.
Okay, I'll admit, that sounds a little sci-fi,
A little bit, right?
but also kind of cool. What does that depth actually do? What's the benefit of getting that deep?
So it's all about reaching those deeper layers where lipodema really, takes hold.
Mm-hmm.
And those oscillations impact everything,
Everything.
from the skin and the fat to the connective tissues, muscles,
Oh, wow.
even blood and lymph vessels.
It's pretty comprehensive.
It is. It's like a gentle internal massage, just loosening everything up.
So it's breaking up those congested areas that make lipodema so uncomfortable.
Exactly.
And I've read that fibrosis, that hardening of tissue,
Yeah.
that's a big issue.
Huge issue. And the source material really emphasizes the deep oscillation personal basic,
Okay.
which is a device specifically for pain management and reducing fibrosis.
Specifically for...
Yeah. And the fact that it can be used at home.
Wow, that's got to be a plus.
It's huge for people with lipodema, especially
Yeah.
when you can't get to a therapist all the time.
Right, regular visits aren't always feasible.
Absolutely.
And speaking of at-home use, one of the things that caught my eye was the economic side of things.
Yeah.
Because if this device can help you manage your condition over the long term,
The long term, yeah.
that could save a lot of money
So much money.
compared to constantly going to therapy
Oh,
appointments.
for sure. And that's not even factoring in travel time
Yeah.
and just the hassle of scheduling.
Oh, yeah. All of that.
It really puts the power in the individual's hands.
I like that. They included some really compelling quotes in the source material from people who are actually using deep oscillation.
Oh, yes.
There was this mother and daughter duo
Ooh.
who both used the device,
Yeah.
and they talked about how it takes away that heavy fluidy feeling from their legs and arms.
Oh, I can imagine how much of a relief that must be.
No, right?
It's incredible.
Just to get rid of that feeling.
I think that speaks to something really important.
What's that?
While deep oscillation may not be a cure for lipodema,
Mm-hmm.
it can really make a difference in how you experience it day to day.
It's about making it manageable.
Exactly. And that can be a huge boost emotionally as well.
Before we get into more of those personal stories, I'm curious about something. They mentioned that deep oscillation isn't just for lipodema.
Oh.
It has pre-programmed settings for all sorts of conditions.
Yeah, it does. Sports injuries, aesthetic concerns, even occupational issues.
Oh, wow.
It's pretty versatile.
So someone could use it for post-workout recovery one day and then lipodema management the next.
Exactly.
That's pretty neat.
It is. It speaks to the potential of these types of devices to really become a part of people's overall wellness routines.
Integrated into their life.
Exactly.
Okay, well, let's get back to those patient experiences because we have a lot of feedback to unpack.
Yes. Let's.
And I'm really curious to hear what people are saying about deep oscillation in their own words.
Me too.
Mm-hmm.
These stories are so valuable. They put a human face on the science and research,
Yeah.
Absolutely.
All right, let's hear it.
Okay, so welcome back.
Mm-hmm.
Before we jump into those patient stories,
Yeah.
I think it's helpful to really understand how deep oscillation works,
Okay.
like at the cellular level. It's pretty fascinating stuff.
Yeah, in part one, when we talked about those gentle oscillations,
Right.
it all sounded kind of vague to me.
Sure.
I'm ready to get into the nitty-gritty now.
All right, let's get technical. So those oscillations we keep mentioning, they're actually created through a combination of electrostatic attraction and friction.
Okay, now you're really losing me.
Okay, picture this.
Okay.
The deep oscillation device creates an electrostatic field, sort of like static electricity. you know?
Okay, I kind of get that.
And this field gently attracts and repels the tissues,
Interesting.
creating that oscillating movement.
So it's not like actually vibrating the tissues.
No,
It's more like a subtle push and pull.
exactly. A push and pull. And that push and pull creates friction
Okay,
between the different layers of tissue.
got it.
And this friction is really important.
Also,
Remember how we talked about fibrosis?
yeah, that tough, hardened tissue.
Right. That's often a problem with lipoedema.
Mm-hmm.
Well, that friction from deep oscillation helps to break down that fibrosis,
Oh, okay.
making the tissue softer and more pliable.
So it's like a deep tissue massage, but without the pressure.
That's a great way to think about it. And
Yeah.
because those oscillations can reach up to like 8 centimeters deep,
Really deep down.
they can really get into those hard-to-reach areas
Yeah, I can see that.
that manual massage might not be able to get to.
That makes sense. What about the other benefits we mentioned, though, like improved lymphatic drainage
I see.
and reduced inflammation? How do the oscillations affect those?
So it's all connected.
Mm.
Think of it this way. When you break down that fibrosis and loosen those tissues, you're also improving circulation.
Okay, so things can move around more freely,
Exactly. Which means that blood can flow more freely to the area.
bringing in all the good stuff.
Nutrients, oxygen,
Mm-hmm.
and at the same time, the lymphatic system.
Which is responsible for removing waste.
Yes, and excess fluid can function more efficiently.
So it's like unclogging a drain.
Pretty much.
You get things flowing better, and
Right.
that helps to reduce swelling and inflammation.
Precisely.
Huh.
And because it's working on multiple levels,
Yeah.
improving circulation, boosting lymphatic drainage, breaking down fibrosis,
It's multifaceted.
it can have a really significant impact on pain levels.
That's got to be a big deal for people with lipoedema.
Oh, huge. They're dealing with
Well,
chronic pain, you
Yeah,
know?
absolutely. But, we talked earlier about how self-care is about more than just the physical aspects.
Right.
It's mental and emotional well-being, too.
For sure.
Do you think deep oscillation plays a role in that?
Oh, I absolutely think it does.
Yeah.
You know, chronic pain can really wear you down emotionally.
Yeah.
It can lead to anxiety, depression.
A sense of hopelessness.
Absolutely.
Yeah.
So when you can effectively address that pain,
Yeah.
it frees up so much mental and emotional energy.
And you can focus on other things.
Exactly.
Yeah.
And plus, there's something really soothing and calming
Mm-hmm.
about that gentle rhythmic oscillation.
I can see that.
It can be almost meditative.
Like getting a massage, it relaxes your body and your mind.
Totally. And let's not forget the empowerment factor.
Right. Taking control.
Exactly.
Yeah.
When you have a tool that lets you manage your condition at home on your own terms,
Yeah.
it gives you a sense of control.
Being in charge.
And that can be hugely empowering,
Yeah.
especially when you're dealing with a condition like lipedema.
That can be so overwhelming.
Oh, for sure. It can feel so out of your control.
Absolutely. Okay, well, you mentioned earlier that the deep oscillation personal basic comes with pre-programmed settings
Oh,
for different conditions.
It does.
Do you want to explore those a bit more?
let's do it. So imagine you've just finished like a tough workout.
Ooh, yeah.
Your muscles are aching.
I've been there.
The sports setting on the device uses specific frequencies and intensities of oscillation
Okay.
to target those sore muscles, promote blood flow, and reduce inflammation.
So it's like having a portable sports massage therapist.
Exactly. And then there's the aesthetics setting.
Oh, interesting.
This one is designed for things like reducing the appearance of cellulite,
Okay.
improving skin tone, even helping with lymphatic drainage after cosmetic procedures.
Wow. So it really is a multi-purpose device.
It is. What about the settings for lipoedema specifically?
Yeah, I was just going to ask you that.
Yeah, so those settings are tailored to the unique needs of this condition.
Okay.
They focus on reducing fibrosis, improving lymphatic flow, and alleviating pain in the affected areas.
So it's almost like having a personalized treatment plan.
Right. Built into the device.
That's pretty incredible.
It is.
Yeah.
And because it's so user-friendly,
Mhm.
people can easily incorporate it into their daily routines.
I love that. Okay, well, I'm definitely ready to hear some real-life stories now.
Yes.
We've talked about the science.
Mechanics.
So I want to know how deep oscillation is actually impacting people's lives.
Me too.
Yeah.
These stories are so inspiring.
Yeah.
They show the real human impact of this technology, you know.
Mhm.
Are you ready to hear about Elisa McCann's experience?
Absolutely. Bring it on. Okay, so we've
Okay.
talked about the science behind deep oscillation
Yeah.
and how it works on like a cellular level.
Mm-hmm.
But I think what really brings it home
The stories?
are the real-life experiences of people using it.
For sure.
We were just about to hear about Elisa McCann's experience.
Oh, yeah. Elisa's story is particularly interesting because she talks about using deep oscillation to prepare for surgeries.
Oh, wow.
Lipoedema surgery can be a big deal.
Yeah, it's major.
And she found that the therapy helped reduce her discomfort
Okay.
and even improve her skin texture beforehand.
I can imagine that would make a huge difference mentally, too.
Right.
Going into surgery feeling more comfortable and confident.
Totally. It's not just about the physical preparation. It's about feeling empowered and in control.
Taking charge.
Yeah. And speaking of feeling empowered, Belle Hardman's story really highlights how deep oscillation can be a long-term self-care tool.
Interesting.
She uses it for managing inflammation,
Okay.
softening the lipodema fat,
Wow.
even as part of her post-surgery recovery.
So it's like having a personal therapist at home,
Right there whenever you need it.
available 24/7.
Exactly. And it sounds like it's not just patients who are seeing the benefit.
Oh, is that right?
We also have the perspective of Sue Hansard,
Okay.
who's a retired lymphedema specialist
Wow.
who advocates for deep oscillation for both lipodema and lymphedema.
Interesting. So she's seen it from both sides?
Exactly. And she even mentions how this type of therapy could potentially reduce the strain on therapists themselves,
Oh, wow. How so?
especially when treating certain areas like the head and neck. That's a good point.
It's huge. Especially with, the increasing demands on healthcare systems.
It makes you think about the bigger picture, doesn't it?
For sure.
Like, could self-care technologies like this help make healthcare more accessible
Absolutely.
and more sustainable?
It's a conversation worth having.
Yeah.
And I think the feedback we've seen, both from individual stories like Elise's and Belle's, and through those 10 questions posed in the source material, shows that deep oscillation is really resonating with people.
It's giving them some control.
It is. It's giving them a sense of control and agency over their condition.
That's really what self-care is all about, isn't it?
Absolutely.
Taking an active role in your own well-being.
Yeah.
Finding tools that work for you.
Exactly.
So if someone's listening and they're thinking, okay, this deep oscillation therapy sounds interesting, but where do I even start? What would you say?
The first step is always knowledge.
Of course.
The source material from Physiopod UK Ltd has some great resources.
For further reading. And they even offer one-on-one Zoom sessions to answer questions.
Well, that's good. Talking to your healthcare provider is crucial, too.
Always a good idea.
They can help you figure out if deep oscillation is right for you and make sure you're using it safely.
Absolutely.
So it's all about finding what works best for your individual journey.
For sure.
And I think the stories we've heard today show that even with a condition like lipoedema,
Yeah.
there's hope.
There is.
There's support.
Definitely.
And there are tools out there that can make a real difference.
Absolutely. And I think the biggest takeaway is that self-care isn't a one-size-fits-all approach.
I agree.
It's about exploring your options.
Yeah.
Finding what works for you and taking an active role in your health and well-being.
Well said. This has been such a fascinating deep dive into lipoedema and deep oscillation therapy. Thank you all for joining us.
Yes. Thanks for listening, everyone.
And for taking this journey of exploration with us.
Until next time.
Until next time, keep learning.
Keep questioning.
And keep diving deep.